I want to welcome everybody to this webinar hosted by the BC Lung Association. My name is Michael Brower, and I'm a professor in the School of Population and Public Health at the University of British Columbia, and I'll be moderating the webinar today. And as you know, the focus of the webinar is COVID-19 and wildfire smoke, a potentially bad combination. We're really pleased to be able to put this on today, and we have a very large audience online, which is fantastic, including people actually spanning the globe. I'll just remind everybody that because we have so many people online, actually over 500 registered, and we've got 250 people connected now. Please put any questions that you have for the presenters in the chat window. Make your questions very short and very succinct, and we will be able to address as many of them as we can, but we will not be able to answer all questions. So I will direct you to some other resources. First of all, on the BC Lung Association webpage, there's lots of information on both wildfire smoke and health, including up-to-date fact sheets and specific information on COVID-19 and wildfire smoke, as well as links to lots of other information, relevant information. So again, please put any questions that you have for the presenters in the chat window. We'll try and get through as many of those as we can. The shorter, the better in terms of your questions. We will also be putting together a frequently asked question answer document after the webinar, where we'll collate some of the most common questions and provide them some answers and links to other resources. So that's additional information that we will be providing for you afterwards. So first of all, I want to wish everybody a happy Clean Air Day. It's Clean Air Day in Canada. Hope the air quality is good where you are, and hope that you can be doing something wherever you are to help improve air quality or improve understanding of links to air quality and health. I'm going to now introduce our two speakers. We're very pleased to have Dr. Sarah Henderson. Sarah is arguably one of the world's leading, if not the leading, experts on the health impacts of biomass smoke. This is a topic that she's been studying for about 15 years. She's currently a senior scientist at the BC Centre for Disease Control, as well as an associate professor at the School of Population and Public Health at UBC. She leads a program of applied research, surveillance, and support of evidence-based policy for the province of British Columbia. And as I mentioned, she's been focused on biomass smoke and its health impacts. And for the last several months, as soon as the pandemic began, she's actually been specifically focused on the links between wildfire smoke and COVID-19 and helping get prepared for the wildfire season in the province of British Columbia. Our other presenter is Dr. Chris Carlston, who is a professor of medicine and head of respiratory medicine, as well as the Canada Research Chair in Occupational Environmental Lung Disease at the University of British Columbia. He's also the director of the Air Pollution Exposure Laboratory and is an expert on inhaled exposures on the human airway, and will provide a clinical perspective and the respiratory health perspective of COVID-19 and wildfire smoke. So without further ado, I will turn it over to Drs. Henderson and Carlston.
Good morning, everybody. Thank you so much for joining us today for this conversation. And as Mike says, happy Clean Air Day. We'll get started right away because we do want to leave a lot of time for questions. I'm going to start by talking to you about what wildfire smoke is. Then I'll hand it over to Chris for a bit to give you the clinical perspective on how smoke and air pollution can cause harm. Then we'll get into the dynamics of COVID-19 transmission, the combination of wildfire smoke and COVID-19, and talk a little bit about what people can do to help protect themselves from this combined risk this summer in BC and elsewhere. So The thing about wildfire smoke is that it's an incredibly complex and dynamic mixture of different air pollutants, both gases and small particles. And when I say complex and dynamic, I mean that if you grab a sample of wildfire smoke from a fire that's burning, and then you grab another sample an hour later, the constituents of that smoke may appear to be very different because it depends on the fuel that's burning, the temperature that it's burning at, how long the smoke has been aging in the air, and the chemical transformations that it has been through. So we're still learning a lot about wildfire smoke, but when we focus on its health impacts, we really focus on these small particles or particulate matter less than 2.5 microns in aerodynamic diameter. And this picture at the bottom shows you these pink balls, and those are the size of PM 2.5. One of the complications with smoke, though, is that the PM 2.5 tends to be made up of much smaller particles that have all clustered together, these little soot balls or tar balls that are created by the fire. And that's what this image is intended to show. So although the diameter of that cluster is less than 2.5 microns, it's made up of a bunch of very small particles. And this is important because it affects how much surface area there is to interact with the lung. We thought we had it working properly, and apparently we didn't. So this is the slide that I was talking about when I was talking about those pink balls and those little soot balls. And you can see right here, this pink sphere is PM 2.5, but when we're talking about wildfire smoke and often other types of air pollution, it's made up of a bunch of much smaller particles that have all aggregated together. So a little bit more on this, an important thing to understand about smoke from wildfires is that most of it is very small particles. So this is just information from Canadian boreal forest. And along the bottom here, we have a log scale of the particle size, so 100 microns across in the far right. And I've drawn a line at the 2.5 marker. And what you can see is that the vast majority of this smoke is under PM 2.5. Only a little bit is in the subset that we would consider PM 10. At this point, I'll hand it over to Chris, and he'll talk a little bit about particles and how they get into and out of the respiratory tract, and then we'll get more into COVID-19 and smoke.
Great, thanks, Sarah. Yeah, so the last slide was perfect to understand this one, but I'll walk you through it a little bit because it's if you haven't seen it before, it's not the easiest to grasp right off the bat. But basically, the colors, the blue, the green, and the red refer to the parts of the lung, and the airway really, because you can think of it as the upper airway, which is called head region there, conducting airways, which are kind of the larger airways in the middle of the chest, and then where the gas exchange happens at the farthest reaches of the lung, we call them alveoli. I'll show you in a second. But then if you refer over to where it says regional deposition, you can see the corresponding color. So let's focus on the red because we're going to get into that shortly. So that's where gas exchange happens in the smallest parts of the microscopic end of the lung. And you can see, if you remember back what Dr. Henderson was saying about the sizes, that roughly speaking, the peak of that red region is in the same region as where most of those particles are from smoke. And so not all, but many of those particles will make it deep. And you'll see shortly why that's concerning on the next slide. Yeah, so these are those alveoli, obviously blown up. That's perfect. That I was referring to earlier, and you can see in the lower left a cartoon of an alveolus, the singular of alveoli, and that shows that the gas exchange happens in that little sac that's right next to, literally microscopically immediately next to the blood vessel. And not only do the gases exchange, but where you see the CO2 out and the oxygen in, we've learned in recent years that actually the particles themselves, those tiny little particles we refer to, can actually slip into the bloodstream as well and then circulate and do damage that way. So that's why it's so important to understand these tiny particles and where they go. And we'll take that further in the next slide. So here's another way of looking at an alveolus. And on the left is more of a normal situation where obviously it's a cartoon, but towards the top of the left image, you see the cells, we'll get back to those in a moment, with their normal mechanism of moving out the particles, those little black dots. And the cell with the smiley face is a macrophage at the bottom. And those macrophages, as you can see, gobble up the little particles and get rid of them, which is what they're supposed to do. But in the context of too many particles, as in what you're seeing there on the right side of the image, the macrophages are overwhelmed. They can't do their job. There's just too many particles. And so they leave some of the particles in the airway, leading to inflammation, which is what leads to some of the health effects. So here's another view of that, and just to emphasize that these macrophages are so important. They're called the garbage cans by some to remind us that they're basically picking up all these little particles and getting rid of them for us. But now, as we start to think about the coronavirus, they're also involved in dealing with, they're really more than just the air pollution particles. They're anything really that's not supposed to be there that they gobble up, including viruses. And anytime that function is impaired or those macrophages can't work as well as they should, the system essentially breaks down and leads to some of the problems we're talking about today. So I said I'd get back to the cilia. So the cilia are these tiny little hairs, these very delicate structures. They're not actually hairs, but they look like them, that line the cells of our airway, which are called the epithelial cells, those pink cells. And normally these cilia move through the mucus, which is relatively thin, and act like an escalator and have a very beautiful motion. You can actually see it online if you just Google moving cilia, and you can see the videos of these moving gently to pull everything up towards the mouth, and then it either goes into the gut or you can cough it out. But in the context of air pollution, those cilia are damaged. The mucus gets thick so they can't move. The epithelial cells, the pink cells, are damaged so that those thin lines between them, which are supposed to be very tight, are loosened. And so the particles can actually get beneath the pink layer and do damage that way. And then there are also these special chemicals in the mucus, which are actually good chemicals that serve to kill bacteria and viruses, and air pollution also damages those chemicals. So all these multiple factors in the context of air pollution, including from wildfire smoke, damage this beautiful system that normally works well. So this idea has been in the setting of different viruses, especially influenza, which has the most research. This idea of how air pollution in general, whether it's from traffic or wildfires, has been studied extensively before coronavirus. And it's, in general, you can look at this paper at your leisure, but in general, the evidence is showing that, as I was illustrating before, those mechanisms come together so that the rate at which the infection can take hold in those cells and in the body is greater, and then it can accelerate and spread, and the virus can replicate itself more easily because those defenses are decreased. And this likely applies, as we'll say shortly, to the coronavirus situation. So here's an example. In this study, I'm not showing because it's the best study or the one that I think is definitive, but just to give you an idea of ways to think about this and evidence that's coming out quickly, but really needs more time to be fully sorted out. This study from China shows, looking at different types of air pollution, you can look at PM 2.5. Again, the number refers to the size in microns. Carbon monoxide, nitrogen dioxide. Either way, these are reflections of that mix that Dr. Henderson mentioned in terms of what comes out of a burning wood, etc. And as you can see, with some delay, which would be expected, the infection rate seems to increase when these pollutants go up. We don't totally understand why. There are some complicated factors that may dictate that, but there is this emerging evidence that this pollution that we're seeing is a risk factor for coronavirus.
Great, thank you. so much, Chris, for bringing the clinical perspective to that. He says all the words properly, and I can't really pronounce them. So very helpful. As Mike suggested earlier, I've been thinking about smoke and coronavirus basically since the beginning of the pandemic and the effects in British Columbia. And we did some early evidence review to look at what was known about air pollution and another famous coronavirus, which was SARS. And there was not too much published on that, but this is one of the papers indicating that shorter term exposure to air pollution did increase case fatality of SARS. And you can see a fairly nice linear relationship here. In that early review, we also found this much newer paper, which was out of New York State, and not specifically looking at SARS, in this case, looking at infections with influenza, but laboratory confirmed infections, which is sometimes hard information to get. And they were able to compare the infections with different constituents of the ambient air pollution. And they looked at 3 different time scales. So when we look at the top here, we've got the total mass concentration of the fine particles, looking at the exposure within 0 days, within 3 days, and within 6 days. And you can see that in all cases, influenza rate was elevated. The excess rate is down at the bottom here. And then they broke this total exposure into different parts of the exposure. Bits from gas, diesel exhaust, road dust. But the thing I really focused on was the biomass burning, which is down here at the bottom. Not very much of the total PM 2.5 was attributed to biomass burning in this work, but the biomass burning had a clear and consistent effect. With comparable with that of traffic-related air pollution, which was a much larger constituent of the total mixture. So some indication that wood smoke is an important driver of these potential interactions between air pollution and respiratory viruses. So at this point, I just want to break and cover a little bit about what we know about COVID-19 transmission so far, and with the caveat that we're learning more all the time. But overall, the primary route of transmission is contact with the respiratory droplets of an infected person when they sneeze, cough, and as the Prime Minister so famously said, speak moistly. When droplets come out of other people's mouths and you are exposed to them, this is the primary route of transmission. There's also likely some transmission through contact with surfaces that have been contaminated by those infected droplets. One of the biggest challenges we face with COVID-19 is that infected people can transmit the virus before they have symptoms, and this makes it more difficult to deal with the virus than it was for something like SARS, where that didn't really happen. People didn't transmit the virus until they were symptomatic. In addition, some infected people will never become symptomatic. And then finally, a little bit about what we know about air pollution. There's very little evidence that the virus can survive and be transmitted through particles in air pollution. But one important potential mechanism is that exposure to air pollution and particles, especially something like wildfire smoke, may make people cough and sneeze more and produce more respiratory droplets than they would under other conditions, which, if they are infected, can lead to wider transmission of the virus. So back in my first slide, which you didn't get to see, I had 4 kind of concerns about the interaction between wildfire smoke and COVID-19. And the first one, which Chris described really well, is this concept of immunosuppression. So co-exposure to wildfire smoke and the novel coronavirus may lead to more cases of COVID-19 disease and more severe cases of COVID-19 disease. And I've put together a little cartoon here to sort of illustrate that first point. On the top left hand, we have an individual who's exposed to the virus and exposed to smoke, and develops the virus because of that co-exposure. In the bottom scenario, that individual is not exposed to smoke and is resilient to the virus, so doesn't develop it. That individual then interacts with somebody who's very sensitive to the virus or very susceptible, who's not exposed to smoke, and that person goes on to develop the virus where they otherwise would not have. And so smoke has really sort of changed the transmission dynamics in this cartoon scenario. So in doing a little bit of early thinking around this, I wanted to examine, how much impact COVID-19 or how much impact wildfire smoke might have on COVID-19. And we borrowed some effect estimates from the SARS literature in China, with the caveat that ambient air quality in China and wildfire smoke are quite different things, but that's the evidence that we had available at the time. And then what I did was apply the air quality conditions in Kent County, Washington during the summer of 2018. So this is this dashed line at the top, versus the air quality conditions that were being experienced as the outbreak unrolled in Washington state. And I chose Washington state here for a few different reasons. First of all, this was an editorial that I wrote for a largely American focused journal, and I didn't think BC was going to get a lot of traction. And B, Washington state, when we started this work, was much farther along in its epidemic than British Columbia was, and eventually had much more cases than British Columbia has had. So it was a little bit of an easier way to illustrate this. And if we apply this smoke, as the pandemic or as the epidemic in Washington has moved along a little bit, when we consider the actual versus estimated cases with and without wildfire smoke on April the 16th, there's a 13% increase with wildfire smoke. For deaths, there's a 10% increase. An important part of this is it really depends when the smoke happens along what we call the epidemic curve. And the epidemic curve indicates how fast the transmission is happening within the population. So if we applied this smoke much earlier in the Washington epidemic, when transmission was happening more rapidly, what we find is that on March 15th, so a month earlier, there was a 34% increase in the total confirmed cases and a 25% increase in the deaths. So it really, really depends when the smoke occurs along that curve. If the curve is flat, it's not going to have such a big impact. But if the curve is rising, it's going to have a bigger impact. And that has some implications for us, especially in the Pacific Northwest, as we come into potential second or third waves of virus transmission that might overlap with our smoke season. So the second concern was really the interaction between the acute health effects of these two different exposures. For wildfire smoke, we're very clear on respiratory effects. Cardiovascular effects are becoming clearer, and then there's more and more evidence being generated around questions like diabetes, pregnancy, cognitive function, and mental health. For COVID-19, there's actually a lot of overlap between the organ systems that we know to be affected, and very clear evidence of respiratory, cardiovascular, and renal or kidney impacts, and then growing evidence also around these other things. So we have these two different health effects that may come together and interact. Third, we have the potential that a severe wildfire smoke season will increase susceptibility to COVID-19 even after the smoke has dissipated. So that exposure to smoke in the summer may make the population more susceptible to virus transmission later in the fall. And this is a very new paper out of Montana, where the large smoke episodes are also quite common. And they looked at this relationship between the wildfire season and the following flu seasons, and found that for every 1 microgram per meter cubed increase in PM 2.5 during the wildfire season exposure, there was a pretty significant impact on the number of flu cases the following season. So that's another potential area of concern for us. And then finally, we have this confluence of multiple public health crises. So we know that the presence of COVID-19 is going to complicate wildland firefighting, and the Wildfire Service has been working on this for as long as I've been talking about smoke and COVID-19. Evacuations, should they be necessary, are going to become more complicated. We can't necessarily use the types of methods that we've used previously while keeping people safe. Restricted access to public cleaner air shelters and cooler air shelters may be a problem. So normally during wildfire season, we'd tell people if they can't take shelter at home to go visit a library or a community center or a shopping mall. Those spaces may not be as available as they've previously been. Equipment for protecting against wildfire smoke, such as portable air cleaners and N95 respirators, which I'll talk a little bit about it further along, may not be as available or readily available as it has been in other years. We're still dealing with significant supply chain disruptions due to COVID-19. Limited public health capacity. It's been very hard for me to make time to work on this issue, given all of the other demands that there are at the BC CDC for more direct COVID response at this time. And then finally, this is the mental health tools of having these different crises pile up. So just to go back to this point of evacuation, this is an evacuation shelter in Winnipeg a couple of years ago during the 2017 wildfires. And I hope it's clear to you that in a situation where COVID-19 is circulating, this isn't going to work. It's not going to fly. So we need to reconsider, how to keep people safe from both of these potential harms. And this is from the Summer of Smoke project 2014 in the Northwest Territories. And it's just a quote from an individual that says, people have been cooped up all winter and then you can't wait for summer to happen and they're outdoors a lot. You feel like you were robbed of summer when you get a summer like that, which is just full of smoke and dark and gloomy. And more we're recognizing that, prolonged periods of smoke exposure take a toll on people's mental health, possibly because some of those physiological mechanisms and also because of the emotional sort of oppression mechanisms, and people are already feeling kind of frayed from COVID-19. So there's real potential for mental health pile up here. There's a little bit of good news. We're heading into our wildfire season in a good place. This is a snapshot of the COVID-19 dashboard from yesterday when there were 4 new cases. We have very few people currently admitted to ICU. We're in a better position than many other places nationally and internationally, where we do have low COVID transmission in the population at this time. That's not guaranteed that it's going to stay that way, but we're starting from a pretty good place. We do know that the wildfire season may be quite extreme. The forecast severity this is the forecast severity for June for nationally, and you can see that things are looking pretty high across BC, and the forecast does look this way all summer. The forecasts don't necessarily come to bear. We had quite dire forecasts at this time in 2019 as well, and we ended up having quite a normal type of wildfire season. But there are indications in the data that are considered for forecasting that things may be extreme. And I really want to remind you that 2 of our previous 4 summers have been very extreme in terms of smoke exposure. These are population weighted averages. So on every day of these periods, what the average person in British Columbia was exposed to. And hopefully you can see that 2017 and 2018 were quite different from 2016 and 2019. And my line on this is we have to expect the worst thing we've ever seen. We can hope for much better, but if we go into the season expecting something worse than we've ever seen before, we'll be in a better position. So from a public health response perspective, COVID-19 definitely complicates summer, and summer was already kind of complicated in terms of different environmental health risks. So down in the bottom here, I've kind of highlighted what we had to deal with before, where we were looking at smoke and hot weather and situations where both were high or low. And now we've added to this matrix a COVID risk, which makes, you know, a lot more rows of this table than we used to have. So, you know, we really have to put some thinking into, okay, if COVID is high and smoke is high and heat is high, how are we going to deal with that? And a lot of how we're going to deal with that is really context specific. It depends on the populations we're talking about, the underlying risk factors and what have you. But doing this thinking now is going to pay off if we do have a hot and smoky summer. There are some intersections and tensions between COVID-19, smoke, and heat, and I just want to highlight a few of them. First of all, natural ventilation is understood to reduce COVID-19 risk, and there's lots of advice to open windows and doors and to do things outdoors whenever possible. Obviously, this is going to increase smoke exposure, and if things do get smoky. So there's a tension there that we need to consider. Air conditioning and air cleaning are the most effective ways for keeping people safe when it is both hot and smoky outdoors. But we do know from some evidence, especially out of epidemiologic investigations in China, that you know, directed airflow is not a great thing for COVID. This is just from a restaurant. This was the air conditioner in this restaurant, and the, you know, the air was sort of circulating among these tables, and people among these tables were infected by this individual here. People on the other side of the restaurant were not infected at all. So we have to be very cognizant of how air is moving indoors. And then finally, the issue of face masks, which has been, you know, contentious enough already. There's lots of different opinions on this, but if you're wearing a cloth mask or a surgical procedure type mask, it does offer some protection from wildfire smoke, but the best protection from smoke would be an N95 respirator. And N95 respirators are currently in short supply in the province, and the supply remains precarious. So those need to be preserved for the frontline healthcare workers who really need them. So just to highlight, you know, this isn't simple. I have no simple answers for you today. The best thing I can recommend is for this season, more than any other season, is prepare to shelter in place at home. We've all spent a lot of time at home anyway. Now it's time to think about how to keep at least one room of your home cool and comfortable. So I'm going with some EPA advice here, which I think is very well provided, and I've given the link. Choose a room that's going to work. A room that you can keep cool is better. Prevent smoke from getting into that room by closing doors, windows, and other outlets, and then stay cool as you can. Air conditioners, if you've got them, fans with cold water in front of them if you don't, or, you know, even better, choose a basement room that's nice and cool if you have one. Use passive measures such as curtains. Filter the air in the room with a portable air cleaner. And I've included two pictures of air cleaners here. One is sort of an out-of-the-box store-bought unit, and one is a homemade unit. We are going to prepare some guidance on making these homemade units at the BC CDC this summer because they're quite inexpensive. There's not a lot of evidence, and certainly not much peer-reviewed evidence, but the evidence that's available does show that they can be quite effective, and they are considerably less expensive than the out-of-the-box model. So if this makes people able to better clean their air, it's something we want to provide information about. Don't generate more smoke indoors, so cooking, vacuuming, those sorts of things. And then stay informed. And my final few slides will just be a bit more about staying informed. First of all, I want to highlight that the BC Ministry of Environment and Climate Change Strategy has now added a be notified about air quality feature, and that includes both email and phone number. So you can get an email or text message or both when air quality conditions are changing in your area. I definitely encourage everyone to sign up. And then there's a couple of great apps that can provide good information about air quality as well at the national scale, the WeatherCan app and the AQHI app. We have a lot of information on the BCCDC website about smoke and health. It's more general, it's not specific to COVID-19, but it's still useful. And I do want to highlight that while we do have guidance on face masks, we have removed that for the time being because we do not want to encourage more demand on the N95 market until we know that the provincial supply of N95s is secure and safe. Once we know that, we will re-add that information back to our website. So that's the end of the presentation as I have it, and I think now we'll start talking about questions, or let Chris add anything further that he would like to add.
No, I just want to let time for questions, so let's do that.
Great, thanks very much, Chris and Sarah. And I'll just remind everybody who is attending, if you have questions, please put them in the chat window. Keep them short and succinct and to the point, and we'll get through as many of them as I can. There are a few questions that have already been received, and we can get started with those. I guess the first one is, and it's not clear this is specific to COVID, but it's really what extra treatment is needed if there's wildfire smoke, especially if one is asthmatic. So I believe this is probably best directed to you, Chris, about basically what individuals should do in terms of managing their disease, perhaps with or without the COVID situation.
Right. It's a tricky question in the sense that we don't have what we'd call great evidence, real studies that would really prove what to do. I generally say that we should do the same thing we do in any case of an asthmatic, where if your symptoms increase, you should increase your medications accordingly. That's called an action plan typically, or a SMART plan. If you're familiar with those, you know what I mean. If not, you can look them up. But I guess what you might be asking is, should you increase your medications in advance? And I'm not opposed to that per se, but I'm also not recommending it because there's just not evidence for it. And of course, medications do have side effects, although they're minimal with asthma medication. So in a nutshell, consider this scenario like any other where you might be triggered by any virus, by any smoke, by any irritant. And when the symptoms go up, you adjust accordingly. Doing it sort of in advance is not a terrible idea, but not something I necessarily recommend up front.
Great, thanks, Chris. There's a few questions, even though you did cover masks, a few sort of questions related to masks. So one would be basically I'm just trying to, related to transmission, and can the virus attach to particulate matter in the air and increase the spread, and would a mask be effective from that perspective? And then also would be related to that would be if you're wearing a mask from the air pollution perspective, and I think you mostly covered this, is that helpful to wear a mask when the air quality is poor, full of smoke, and if so, what type is best? So maybe just a little more discussion about the whole issue of masks in and outside of the COVID context.
Okay, so to the first part, we don't expect that COVID's going to attach to particles and then be transmitted that way. We do expect that air pollution may make people cough and sneeze more, and if they're infected with COVID, that will help transmit the virus. So, wearing masks won't protect you in that particular circumstance, but what wearing a mask will do is help to protect you from exposure to those respiratory droplets if people are coughing and sneezing more. So into masks more generally, you know, we've got a few different types of masks. We've got cloth masks, we've got surgical or procedure masks, and then we have N95 respirators. Cloth masks and surgical and procedure masks can help to reduce COVID-19 transmission, partially because people wearing them are not going to get their respiratory droplets out as far as they would if they weren't wearing them and they coughed or sneezed, and partially because they can help to protect, especially more surgical masks or procedure masks, respiratory droplets from coming in from other people. N95s are very good at protecting from respiratory droplets coming in, and that's why we really need to reserve them for our frontline healthcare workers, because they need that level of protection. N95s are also the best protection from smoke. So cloth and surgical masks will provide a little bit of protection. That's what the evidence shows, but the best protection does come from a well-fitted N95 respirator. So we're sort of in this tense place where, as a person who wants you to protect yourself from wildfire smoke, an N95 respirator is the best thing to recommend if you're going to wear a mask, though we generally recommend that cleaner indoor air is the better or best way to protect yourself. But we also don't want you to wear N95 respirators because we really want to reserve those for our frontline healthcare workers at this time. So there's no, as I said, there's no easy answer here.
Could I just add a little bit, real brief? So as far as I agree about the SARS viruses not attaching to particles, but the reason I'm adding to that is just because some people may see in the literature these reports of finding, quote unquote, finding the virus on particles. And I just want to be clear that that's finding genetic material. I don't want to be too complicated, but that's finding evidence of genetic material related to the virus, but not a live virus. So the virus needs to be living to do damage. And long story short is no one's shown, to my knowledge, living virus attached to smoke-related particles. So just be aware if you hear about that. That's one point. The other is that I know from Shane as well, I was looking at the chat, it was asking about surfaces, and Dr. Henderson covered this. There is also controversy about whether transmission is mostly through droplets, which are the little liquid-based droplets that are containing the virus, versus surfaces. And it's controversial, but I do think, in fact, Dr. Henderson helped me with this recently, that the surfaces are less concerning than I previously thought. And I'm just saying that because Shane mentioned that I had said something in a previous conversation. So I do want to emphasize that even in the last several days, I'm seeing the surfaces a little bit less concerning, but obviously we have to be very careful because you don't want to just touch surfaces and not be worried and touch your mouth, because it's still a concern.
No, we certainly don't want to say that surfaces are not a concerning route of transmission, but the primary route of transmission is exposure to respiratory droplets. Hand hygiene and all of those things that we're doing for surfaces are still important ways to protect yourself.
So I've got two more questions related to response. So I'll take them in order. One is, you basically mentioned, Sarah, ventilation being important, and if we expect extreme heat events to worsen, what are the plans this summer for public cooling centers as well as clean air centers for those who can't achieve cooling or air filtration in their homes in the context of COVID? And then the next level up, I guess, in terms of response is, what about evacuations, and how do you think decisions could be made and what form they could take, again, related to both smoke and COVID risks?
Okay, so in terms of planning for cooler, cleaner public air spaces, that's not, the BCCDC can provide guidance for that, and we are certainly helping to develop that. There's already some available from the EPA as well, but that responsibility for creating those shelters tends to fall to municipalities and bound councils and all those different agencies that have a role in this. So the best we can do is try to provide them with good guidance on how to move forward. And I think there's lots of interest in this, and there's already been lots of provincial conversation about it. Again, I can't say we're going to find a perfect solution, but I think at least lots of people who are making these decisions are heading into the summer feeling fairly well informed about at least those tensions that I talked about. In terms of evacuation, I think we have to really differentiate between evacuation due to direct fire risk and evacuation due to smoke exposure. When it comes to evacuation due to direct fire risk, I think, safety will be prioritized over everything else. So making sure that people get out if they're going to be unsafe staying there is going to take priority over the kind of physical distancing measures and all the other things we've been talking about for COVID-related risk reduction. I'm not sure what plans are with respect to kind of evacuation shelters like that situation in Winnipeg, but I'm sure that people are thinking about that, and I've had a couple conversations about it. I'm not really sure why my voice is coming back to myself right now. When we're talking about evacuation for wildfire smoke, in general in BC, we really try to avoid that. We try to enable and empower communities and people to shelter in place for a couple of different reasons. First of all, evacuation is very stressful and very trying. Second of all, those evacuations, if they're related to air quality, often happen too late. A lot of exposure has occurred before populations get evacuated. They get evacuated and then the smoke clears and what have you. So we really, really want to focus on the ability to be able to stay at home in a cleaner, cooler indoor space.
Next question is there a link between open burning restrictions throughout the province and COVID-19 infection reduction?
Yes. So as we came into the outbreak in British Columbia, we didn't know what was going to be ahead. We didn't know, BC was going to respond very well and flatten our curve very effectively. And one of the recommendations that we made to help protect the health of the population as much as possible was to reduce open burning in what is generally, kind of prime open burning season, so that we were not putting more smoke into populated areas and potentially creating some of this immunosuppression that might lead to further transmission of the virus.
I think the question was actually, do we know anything about when open burning restrictions were put in place, or where, and actually reductions in infections?
Yeah, I think that the person's almost like asking, since Sarah led this effort to persuade the authorities to have that burn, whether it actually had the effect desired. And I'll let Sarah answer, but I think, it makes sense. It's for the right reasons, but I don't think we have the data to prove that the restrictions on burning were definitive or any part of how well we flattened the curve. I'd like to think so, and it didn't hurt, but I don't know if we can prove it.
Yeah, I don't, without the counterfactual world where we had the same epidemic play out without those restrictions in place to see how many more cases there were, I don't think we'll be able to prove it either. I like to think that we did maybe help to flatten the curve a little bit, and I hope and that evidence will come from other places where they're going to be better able to generate it. Particularly, there's been a bit of a patchwork approach to this across the US in terms of prescribed burning and open burning, and there may be in due time ability to better understand what those types of restrictions, what role those types of restrictions may play in pandemic situations like this.
Okay, go ahead.
One thing that might be worth saying that sort of relates to this is, and Sarah mentioned it, that when sheltering in place, it's really important not to sort of work against oneself by creating particles in the home. whether that's incense or anything that creates particles in the home. There is some evidence actually that in a very different situation in China, but that as the air quality improved in China and people were sheltering in place, that in places that did a lot of home wood burning and other local generation of particulate matter in the home, that some people actually got more exposed to particles because they were spending more time at home and burning lots of stuff. And so you guess it's something just to be cautious about, that you, as she said, you stay at home, but don't create more particles in the home.
There's a number of questions related to basically not wildfire smoke, so I don't think we'll address them directly, but other forms of air pollution, including sort of thinking forward about residential wood smoke later in the summer and in the fall, and sort of related to that, I guess, kind of what can citizens do in terms of air quality. I'll actually take a stab at this first and let Sarah and Chris weigh in. So first of all, we felt it was very important actually to focus now on wildfire smoke. That is the immediate concern and generally is our greatest concern in terms of air quality and health in the province. It's the wildfire smoke events when we have the highest levels of air pollution exposure in the province typically. So that was the reason for this focus. Moving forward, we may consider having similar webinars later in the year, focused on other sources of air pollution. And I'll just make people aware that the BC Lung Association, as well as the BC CDC, has lots of information on health impacts and guidelines related to other sources of air pollution, including residential wood smoke. Related to this issue, there have been a number of questions sort of about what can people do. And I would say that in the example of the agricultural burning that Dr. Anderson mentioned, this really did come from citizen complaints initially. People seeing plumes of agricultural burning, contacting either the Ministry of Environment or, depending where they are, the agency that manages air quality, their airshed management groups. In Metro Vancouver, it's Metro Vancouver. And it was the those environmental agencies responsible for air quality then relating this concern and these issues to BC CDC and to regional health authorities, and sort of all of this information got up to the point where these open burning restrictions were put in place. So I would just encourage people, if there are poor air quality situations and sources wherever you are, to raise them to your local officials, raise them to the Ministry of Environment, and that's how the process will work. And it may be that later on in the year we have to be considering other restrictions related to air quality in the context of the pandemic. And Chris and Sarah, anything else you want to join in the last 30 seconds or so?
I just want to thank the BC Lung Association for everything they do, including setting this up today. And thanks, Sarah.
Yeah. Well, thanks to Chris and Mike, and also thanks to everybody for your interest in this topic and hoping to propagate some of the information that you've got here today.
No transmission.
So, please join me with a virtual round of applause to our presenters. And thanks to everyone who's attended, just for your interest, your participation, and your questions. And thanks again to the BC Lung Association for organizing. And with that, we will end the webinar. Thanks very much, and happy Clean Air Day, everyone.